Post-traumatic stress disorder is an anxiety disorder that develops after an individual experiences or witnesses a traumatic life event or life-threatening situation. These situations must cause feelings of stress, horror, or helplessness. Even if the event causes serious injury or the threat of a serious injury, it may also lead to the diagnosis of post-traumatic stress disorder. In addition to the occurrence of traumatic events, other factors may contribute to the development of PTSD. Individuals may be genetically predisposed to anxiety and depression. Also, the amount and severity of the traumatic event determines severity of the symptoms. Lastly, the brain's chemical response to stress are individually unique and instrumental in levels of anxiety. There could be many causes of post-traumatic stress disorder, regardless of severity. Among the most recognized is war and combat. 1 in every 8 returning soldiers from Iraq and Afghanistan develop PTSD. Another common cause is rape and sexual assault. Rape-related post-traumatic stress disorder, abbreviated RRPTSD, is consistent with violent crime rates in the U.S. Almost 1/3 of all rape victims experience PTSD at least once during their lives, while more than 1 in 10 rape victims continue to experience symptoms currently. Other causes include natural disasters, terrorist attacks, serious accidents, child neglect, abuse, and captivity, and even the sudden death of a loved one. As we can see, there are many different ways in which an individual can develop PTSD, but it is important to understand that not one particular cause results in more severe symptoms than another. Based on the DSM-5 criteria, in order to be clinically diagnosed with PTSD, the patient must have experienced or witnessed a traumatic event in their lifetime. He or she must have feelings of intense fear, horror, or hopelessness. He or she may also experience distressing recollections of the event, also known as flashbacks. He or she may also avoid stimulus or situations that may remind them of the event. They may also experience difficulty falling or staying asleep, difficulty concentrating, or a general inability to function normally. Symptoms may not be caused by medication or other psychological disorders. Lastly, symptoms must persist for at least 1 month to be diagnosed with PTSD. However, PTSD is not limited to those symptoms. Sudden, unexplained outbursts of anger, nightmares, hallucinations, and irritability, increased arousal or being easily startled, increased alcohol or substance use, and loss of interest in things that were once important. There are many treatment methods for PTSD, but they can vary in efficacy. Cognitive behavioral therapy is among the most widely used therapies. Its goal is to identify the specific thoughts that elicit anxiety. With the help of a trained therapist, patients learn to replace harmful thoughts with more accurate, less distressing thoughts. They also learn to regulate their negative emotions by coping with anger, guilt, and fear in healthy ways.
Okay, so tell me about that day.
Exposure therapy also aims to decrease feelings of fear for PTSD patients. Because feelings of fear have been learned through thoughts, feelings, and situations that remind sufferers of traumatic events, the idea of exposure therapy is that this learned association can be changed. Therapists teach patients how to react differently to stressful memories through a process called desensitization. This allows patients to slowly expose themselves to stressful memories while they think rationally and remain calm. Virtual reality exposure therapy is a fairly new technology in which patients are exposed to artificial controlled stimuli through virtual reality software. This way, patients are able to confront their anxieties in a safe environment and learn to cope with situations that may cause fear reactions. Because chemicals in our brain affect the way we feel, medication is also an effective treatment of PTSD. SSRIs, or selective serotonin reuptake inhibitors, are antidepressants that reduce feelings of sadness and anxiety. Medications such as Celexa, Prozac, Paxil, and Zoloft are known to be very effective for PTSD patients. Although certain treatments can be more effective for individuals than others, it is necessary for therapists and patients to work together to explore which method will be most helpful. Additionally, the combination of medication and therapy, rather than solely medication or solely therapy, will result in the best outcome for patients. It is clear that PTSD is an incredibly tragic disorder that can consume the lives of those who suffer. But with a clear understanding and compassion, along with new treatment development, the disorder can be conquered.